Hello, I'm Dr. Alan Willis with Northeast Alabama Vascular and Vein Specialist. I'm a vascular surgeon who takes care of a lot of chronic venous insufficiency. You may ask, what is chronic venous insufficiency? And this is the way I describe it to my patients. Chronic venous insufficiency is an overview topic. It includes varicose veins, it includes heaviness, swelling, pain, fullness, tightness, skin changes. Occasionally it involves varicose vein ulcers or venous stasis ulcers. These fall under the overview or the major title of chronic venous insufficiency. So we have here at Northeast Alabama Vascular and Vein, we have a treatment plan which is set up to be conservative and interventional. Our conservative treatment plan helps to improve all of the symptoms that we discussed before. So what are the causes of chronic venous insufficiency? Well, there are actually many. You can have a previous blood clot in your leg. Also, you can have faulty valves in your venous system that can also cause those symptoms that we discussed earlier. Whether it be previous DVT or faulty valves, or even if you have many of those symptoms and have neither of those problems, we can still treat you with a conservative treatment plan. So how do we treat this issue conservatively? Well, first of all, we always attempt to try compression hose, usually in the range of 20 to 30 millimeters of mercury. That's in the middle of the spectrum that I would put from very light to a heavy. The very light types of compression hose are going to be 10 to 15 millimeters of mercury. More aggressive treatment would be 20 to 30, and then very aggressive would be 30 to 40. So that would be where we start. Typically, I ask my patients to start with a 20 to 30 millimeter of mercury compression hose. Those are called graduated compression hose. Secondly, we get you into a ambulation program or an exercise program. Everything that we do with this conservative treatment is to try to mobilize fluid and mobilize blood flow out of the lower extremities and out of the legs. The exercises that we use stimulate the calf muscles and stimulate the legs to help promote fluid from the feet up out of the legs. So we do calf raises, we do leg lifts, or we just walk. All of those things will help to promote that fluid up and out of the legs. Next, we use massage therapy and skin care. These are things that you can do at home. We love coconut oil. It's a natural product and it can actually be found in the cooking aisle at your local grocery store. It's a solid at room temperature, but it warms up on your hands and becomes a more oil type mixture. What we ask you to do is start at the foot and you work any excess fluid from the foot up, doing self-massage if you're capable of doing so, and trying to get any excess fluid to come up out of the legs. Everything that we want to happen is for blood flow to move from distal up proximally. Next is a difficult one for many of us, weight loss. 5 pounds, 10 pounds can make a huge difference when we're discussing chronic venous insufficiency and the symptoms of heaviness, fullness, tightness, skin changes, venous stasis ulcers. All of these things are very important in combination. So during our aggressive conservative treatment, 5 pounds of weight loss or 10 pounds of weight loss can really tip you over the scales, no pun intended, to an improved symptoms and improved symptomatology. Next would be leg elevation. Obviously, if we're trying to get the fluid and get everything moving from distally to proximally, we use gravity as our friend. If we're watching TV, if we're reading a book, if we're working on our laptop or iPad, we would like for you to elevate your legs. Now, we know that that's not going to be possible all the time. Job situations, obviously if you're exercising, you're not going to be elevating your legs. But when you're at your leisure and you're doing things that are not conducive to moving that fluid, just sitting, we ask you to elevate as much as possible. If you're in a car and you're riding for a long period of time, we ask you to get out and walk. Those type things help stimulate that fluid moving from distal to proximally. And note, all of these things are designed to help that happen. What happens if you get better from this conservative treatment plan or you don't get better? Well, it's all according to what your causes of your venous hypertension or your chronic venous hypertension are. Sometimes there are other more aggressive modalities that we use, actual occupational therapy and physical therapy. And there's also some interventional procedures that we sometimes use if conservative treatment fails. I hope this video can help you with your journey through your conservative treatment plan for chronic venous insufficiency. Just know that we're here for you. We're here to help you through this journey. We're here to help you in any way we can. If you need us, all you have to do is call us, 256-894-6800, and we'd be happy to talk to you about these issues or any other issues that you may have regarding your vascular surgery issues.